we're going to discuss glaucoma. And glaucoma is an eye disorder. It's basically a leading cause of blindness in the world, and one of the leading causes. And it's really an issue of pressure in the eye, increased pressure in the eye. Just like how you would have increased blood pressure, you can have increased pressure in the eyeball as well, and that's known as intraocular pressure. Best thing to do is show a diagram to illustrate what's going on. The first thing I wanted to mention is this diagram right here. I'll circle the cornea, and then you have the iris. And if you notice in the cornea and the iris at the periphery right there form an angle. I think that's pretty good. The iris and the cornea, they form an angle, and that angle sometimes is distorted, and when that angle is distorted, that's when the problem starts. Why? Well, in this chamber right here, this anterior chamber, you have a fluid, and that fluid is called aqueous humor. And that fluid is important. It helps maintain the pressure in that area, also provides nutrition, and also helps fight infection. Now, that fluid is produced by the ciliary body, and when this angle between the iris and the cornea is distorted, that fluid is not able to escape or flow out. And now that brings us to this diagram, which is over on this side. This diagram is of course a blow-up of what's going on over on this side, but this diagram has a couple more things. So we already mentioned the iris and the cornea, and we mentioned that these two things, the cornea and the iris, form an angle, and that's the angle right there. I'll draw it again, maybe use a different color because I want to really point that out there. And the ciliary body produces that fluid known as the aqueous humor, and these arrows here, the red arrows, are pointing to the flow of the aqueous humor after they're produced by that ciliary body, and they go into these chambers. This chamber in here is the posterior chamber, and then eventually the fluid gets into this part, which is the anterior chamber. And then the fluid escapes or exits through this canal known as the Schlemm's canal, and also the trabecular meshwork. Those are the two responsible for the exiting of this fluid. If the fluid, which is known as the aqueous humor, is not able to escape, that's when you get glaucoma. Because the fluid, if it can't escape, it stays in this anterior chamber and posterior chamber, and that can increase the pressure in that area. So that's the heart of it. So let's go back to writing about this. Actually, I want to touch a little bit more. Why does this happen? I think that it's good to have the diagram here, otherwise it's too abstract. The reason this happens is because right here you have something called a lens, and as people age, this lens continues to grow. And when that grows, imagine what's going on. It pushes this iris upward. As that lens grows, the iris gets pushed upward. And as the iris gets pushed upward, that angle begins to narrow. And let's see if I can draw that again. So you got this lens that's getting bigger as the person ages, that pushes this iris upward, and as a result, that angle between the cornea and the iris is now narrowed, and that narrowing is what blocks the outflow of that aqueous humor. And when the outflow is blocked, the aqueous humor fluid stays in that chamber, and when the fluid is not able to exit, it stays in the chamber and causes the pressure in that chamber to rise, and also known as intraocular pressure. Okay, and one final thing about this diagram over here is the most of the aqueous humor, which is the fluid, is produced by the ciliary body, and it exits the eye right here. These are the two exiting areas. When it's not able to exit, that's when you have a problem of glaucoma. So those diagrams are very important, and I really wanted to explain that as clearly as possible. So now before we get into the symptoms, a lot of it is summarizing. So you've got basically a situation of elevated intraocular pressure. So why is this important? So what? Someone's got intraocular pressure that's really high. Well, the reason it's important is because elevated intraocular pressure can lead to damage of the optic nerve. And the optic nerve is extremely important in vision. And if that's damaged or atrophied, atrophy is another thing that can happen, that can lead eventually to vision loss. So that's why this is important. There's of course two types of glaucoma. There's open angle, and then there's closed angle. What's the difference? Well, if you remember, the angle is formed by the iris and the cornea. They form this little angle here, and open angle just means that angle is normal, but the fluid known as the aqueous humor is not able to exit because of some sort of deposit or plugging or scarring in that area, the Schlemm's canal or the trabecular meshwork. Closed angle means that that angle now is narrowed, and the narrowing is the reason why the aqueous humor is not able to exit. So that's the main difference between closed angle. So you can think of no narrowing of angle, but some sort of scarring or plugging or deposits of some sort that's causing the aqueous humor to not be able to outflow. Closed angle means that there is indeed a narrowing of that angle between the iris and the cornea, and that's causing the problem where the fluid is known as the aqueous humor is not able to escape. So that's just the difference between open and closed. And so why does this happen? I touched on this just a little bit. One of the biggest reasons that happens is as a person ages, this lens grows in size, and as it grows in size, it pushes the iris upward, and as the iris goes upward, that angle between the cornea and the iris get narrowed, and that causes this obstruction of the outflow of the aqueous humor. So that's one of the many reasons. And glaucoma can be acute or chronic. It can be sudden or something that develops over time. And I guess now we can get into the symptoms. So I guess what we'll do is we'll make a little table here of symptoms of acute and chronic. So acute glaucoma, you'll have ocular pain, sudden eye pain, red eye. Red eye is very common. You can have decreased vision. You can see halos, and you can have headache, and you will have nausea and vomiting. And you also have a dilated pupil. That's also important. This is a ocular emergency. So chronic, as the name implies, happens more gradually, and that can also present with similar features like ocular redness, but you have more like blurred vision, and you can have headache as well. And then eventually chronic form can lead to vision loss or blindness. So how do you diagnose this? How do you diagnose glaucoma? Well, glaucoma is diagnosed basically just like how you diagnose somebody with high blood pressure. you diagnose glaucoma by measuring the intraocular pressure. So what you're measuring is this aqueous humor that has built up in this anterior chamber. How much increase in pressure is that causing? And measuring the IOP is really the way to diagnose it. Of course, along with the symptomatology that the patient presents with. Okay, so then how do you treat it? Well, there's several medications, of course eye drops, that are used, and I want to touch about 3 of them. After I list them, I'll explain why each one is used to treat. Timolol, of course these are all going to be given as eye drops, decreases the production of the aqueous humor by the ciliary body. Remember the ciliary body, do we have it in here? Yeah, here we go, right here. That is what's responsible for producing that fluid known as the aqueous humor, and timolol decreases the production of it, so that helps decrease the intraocular pressure. Pilocarpine, how it works is it opens that trabecular meshwork, and that allows the aqueous humor to flow out, so allowing outflow of the aqueous humor. I'm abbreviating it AH. So where's the trabecular meshwork? Oh, it's right here. And remember, that's part of the exiting of the aqueous humor. And finally, mannitol. You might even remember mannitol from other medical conditions. It's a diuretic. It's an osmotic diuretic. So why are we using that? Well, remember, aqueous humor has water in it. And when you use a diuretic, essentially what it does is it removes the water from the aqueous humor. Removes the water from the aqueous humor. And that reduces the volume of the aqueous humor, thus decreasing the intraocular pressure. So these are the 3 medications that I want you to remember. And I guess we are now ready for the vignettes. So here we go. A 59-year-old man comes to the emergency department because of severe headache. Headache came on suddenly as he was leaving the light show at the planetarium. He also has right eye pain, nausea, and he vomited twice. He has no significant past medical history. He has other headaches in the past, but never experienced anything like this. Temperature is 98, blood pressure is 130/90, pulse is 75, respiration is 18. Physical exam shows a tender red right eye, partially dilated pupil, but is otherwise unremarkable. Most appropriate next step is, well, if you remember all the symptomatology of glaucoma, this is an acute event. He's presenting with acute glaucoma. This is an ophthalmologic emergency. Let's go through these here. Administer glucocorticoids intravenously. Well, nothing in our presentation talked about steroids, so probably not that. Administer sumatriptan. Sumatriptan is given for headache, so that seems like a good idea, but this headache is not just a headache. It's a headache is sort of a manifestation of his vision problem, so that's probably not the best answer. Give him oxygen therapy. That's also a treatment, if you remember, for cluster headaches. So this is a vision problem, so it's not that. Measure intraocular pressure. Well, that makes the most sense because that essentially will give you the diagnosis of glaucoma. Order CT of the head. That's a good choice because he does have vomiting and nausea and headache, and sometimes that can be like a brain tumor. But what they're saying is the next step. And anybody who's worked in an ER knows that you do the cheapest stuff first. And D is a lot cheaper than ordering a CT. So, and finally, and this one I couldn't fit it in the answer choices, but it's okay. 45-year-old woman is brought to the emergency department by her husband because of excruciatingly painful left eye. They were at the movies when she began to complain of blurry vision, severe headache, and she had to run to the restroom to throw up. The pain settled into her eye on the right On the ride over to the hospital, she is now complaining of seeing halos around lights. Her ophthalmologic history is significant for several dendritic herpetic ulcers over the past few years. Physical exam shows conjunctival hyperemia and an edematous left eyelid. The cornea appears steamy, and the pupil is fixed and mid-dilated. Left eye is tender and firm on palpation, and the tonometric testing reveals an intraocular pressure of 67. Immediate management. Okay, they've given you a lot in this question. Basically, this is a case of acute glaucoma. Again. And this is, of course, an ocular emergency. And all the symptoms are there, you know, the halos and the blurred vision and the headache and the dilated pupil. So what they're asking for is how would you manage this? Now, I'll put in the answer choices for you that seem to have mysteriously disappeared. The answer choices are mannitol, CT of the head, lumbar puncture, iridotomy, which is a surgical procedure, and steroids. Okay. Well, like I said, nothing in our presentation talked anything about steroids, so that's out. CT of the head, again, you know, because the patient had headache and vomiting, that is a relatively good answer choice, but it's not the next step because, you know, CTs are expensive, so probably not that. Lumbar puncture, there's nothing in the clinical vignette to suggest that she needs that, you know. I mean, it doesn't sound like it's meningitis or anything of that nature. So now we're down to 1 and 4. Iridotomy, I didn't touch on that, but just in case you're wondering, it's a surgical procedure, and it's a surgical procedure that sometimes is used to treat glaucoma. Now, between 1 and 4, what do you think the next choice would be? I mean, the next step, if you had a choice between giving some eye drops or doing surgery, of course, you always do the simplest thing first. So the answer is the first choice, which is mannitol. And just in case you don't remember, mannitol is an osmotic diuretic that decreases that removes the water from the aqueous humor, that fluid, and thus decreases the volume of the aqueous humor, which thus decreases the intraocular pressure.